Today's topic is incredibly heavy. And to be honest with you, it really hits home for me right now, as a member of my own family is navigating this exact scenario. When an oncologist looks straight at you and says, "It's time to call the palliative care team," the world tends to stop. A wave of questions will hit you and is usually accompanied by an overwhelming amount of worry, confusion, and anxiety. In this video, I want to unpack 5 of the most commonly asked questions that patients and families face at this exact crossroads. And importantly, I'm going to give you actionable steps that you can bring to your next appointment. Let's talk about it. Welcome to Palliative Care Explained, a channel aimed at answering your questions about palliative care. My name is Dr. Jonathan Wong, and I'm a palliative care doctor based out of Winnipeg, Canada. Please see the welcome video for my declaration that I do not have any conflicts of interest or any financial sponsors, and for the medical legal disclaimer statements. When an oncologist mentions the words palliative care, it often triggers a wave of questions and anxiety. All too often, people think of this as where oncological care stops and where end-of-life care begins. Instead, I would encourage you to think of it as more of an ongoing partnership and an integration of skills. In fact, the American Society of Clinical Oncology, or ASCO for short, strongly recommends patients with advanced cancer to receive dedicated palliative care services early on in their cancer diagnosis and alongside life-prolonging treatments. Ideally, it should not be a stop-and-go type transition. So let's talk about 5 commonly asked questions I hear from patients and families, and with each, I will give you practical steps for your next appointment. Common question number 1. If my oncologist brings up palliative care, does that mean I am imminently dying? Not always. Palliative care is not just for people who are imminently dying. Let me explain. Palliative care has historically been viewed as synonymous with hospice or end-of-life care. But that's the old way of looking at it. In modern practice, palliative care is a medical field focused on improving quality of life at any stage of a serious illness. And in the setting of cancer, earlier integration of palliative care offers benefits for both patients and their families. For patients, it offers improvements in their symptom control, improvements in their mood and coping, and as a result, improvements in their overall quality of life. For caregivers and family members, early integration of palliative care also helps with their coping and optimizes decision-making and preparation as it relates to end-of-life issues. Now, the reason I say not always instead of a firm no comes down to a few real-world factors. Sometimes it's a matter of limited resources in your local healthcare system. Other times, it's because doctors themselves worry that bringing it up will cause you fear or hopelessness. Modern medical education is trying to change this type of practice, and videos like this are aiming to change public perception. So here are some actionable steps I would suggest. Take charge of the conversation and ask your oncologist what the timeline of your cancer looks like. Specifically, ask whether your prognosis is measured in days, weeks, months, or years. Don't guess, and don't assume what they're thinking. Just ask them. As well, ask your oncologist why they feel having the palliative care team involved can help you, specific to your cancer journey and timeline. These questions will give you a better understanding of your illness trajectory and how the palliative care team can provide you with support. Open lines of communication will also serve to allow your oncologist to better understand your specific fears, needs, and goals. Common question number 2. Are you giving up on me? Absolutely not. Oncologists are not throwing in the towel. They're not giving up on you. In fact, look at it this way. They're calling in help to better treat you. Having the palliative care team involved is inviting another set of eyes and ears to contribute to your care. Every team member in healthcare has a different set of skills and perspectives. By combining our efforts, the added diversity will enhance overall care by introducing ways where your healthcare team can treat you and support all the different aspects of you, instead of solely focusing on your illness. By not solely attempting to cure the cancer, for many, this may feel like a form of abandonment or giving up. But in reality, by bringing in reinforcements, your bigger team can give focus to your well-being in addition to treating your illness. So here's my suggestion. Openly discuss with your oncologist or healthcare team about how they will remain in your circle of care, what role they will continue to have, and how they will work with the palliative care team to better enhance your quality of life. This can help you to better understand everybody's role and how they can all contribute to your care. Common question number 3. Does palliative care mean I need to stop my cancer treatments? Not necessarily. It depends. You see, your cancer treatment options are determined by the nature of your illness and how well your body has responded to treatments to date, rather than the presence of the palliative care team. The palliative care team is not the roadblock. Historically, when the idea of palliative care is brought up, treatments have become either ineffective, have become intolerable, or were predicted to make the patient feel even worse. And this can include chemotherapies, immunotherapies, and radiation treatments. However, in modern practice, and in the context of modern treatments, there are many active cancer treatments that can be continued alongside the palliative care team's involvement, provided the treatments are desired and tolerated by the patient. This is what I would suggest. Openly discuss with your oncologist about which cancer treatments are available and most appropriate for you, and whether their use is compatible with your goals and expectations. But here is an important distinction. There is a difference between having a palliative care specialist join your team as an extra layer of help versus being officially enrolled in a regional palliative care program or hospice program. These are not the same thing. Many formal programs can have strict rules about which active treatments can continue, and those rules vary depending on where you live. But in many centers, the palliative care team can follow you and be part of your team without the need for enrolling you into a program. As such, I would encourage you to ask your oncologist about what resources are available in your community and what their rules are. Common question number 4. Will palliative care shorten my life? Let's bust this myth right away. Good palliative care does not shorten your life. Let me say it again. Good palliative care does not shorten your life. In fact, there are several major studies that have shown that early integration of palliative care can help some cancer patients live longer. How, you may ask? By decreasing the symptom burden, such as that from uncontrolled pain, shortness of breath, and nausea, patients tolerate their cancer treatments better. By being better equipped with mental health supports and coping strategies, patients tolerate and stick with their cancer treatments longer. Good palliative care also allows for patients to better understand their illness and to better explore their preferences at end of life. and as a result, are better equipped to make good decisions that meet their goals. So palliative care seeks to make you live as well as you possibly can and within the limits of your present condition. Good palliative care also focuses on factors beyond treating your cancer. It can enhance your quality of life by addressing the social, cultural, and spiritual factors that also have a role in your life. So here's my suggestion. Do not hesitate to tell your oncologist about the symptoms you would like to see improved upon, both physical and non-physical. Openly discuss with your oncologist about how the addition of the palliative care team can improve symptom management and enhance your overall care. Having more sets of eyes and ears contributing towards your care can result in you living better and feeling better. Common question number 5. Who is in charge of my care now? Your care should be a shared responsibility. The historical practice model had a single physician in charge. In modern practice, your care is a shared responsibility across many team members. Team members have different roles and areas of expertise, and they all work together to meet your care needs. You should not have to choose between your oncologist and your palliative care team. Your teams should converse and work together to provide you with the best care possible. Ideally, it should be an integrated approach to you, the person, and not just you, the illness. This is what I would encourage you to do. Openly discuss and clarify with your oncologist about their role and how they will remain in your circle of care. Talk about the stressors relevant to your life. Discuss how your goals and expectations can be met and which team members are best equipped to help you achieve those goals. Discuss your worries and fears and ask how your healthcare team as a whole can address those. In summary, navigating the crossroads of oncological care and palliative care is undeniably emotional. But I hope today's video shows you that it doesn't represent closing doors. If you take away just one thing from our conversation today, let it be this. By combining efforts, the added diversity in your healthcare team will enhance their overall care by introducing ways where they can treat you, the person, and support all the different aspects of you instead of solely focusing on your illness. As a closing thought, I want to share a powerful metaphor with you. This was published in JAMA Oncology in May 2022 by Dr. Zimmerman and Dr. Mathews. The title is Palliative Care is the Umbrella, Not the Rain. I will share the graphic with you in this video, but I would also encourage you to read the article as well. I will leave a link in the description box below. If you found this video helpful, please consider sharing it with someone who might be navigating a difficult diagnosis right now. Thank you for watching Palliative Care Explained. Take care, and we'll see you in the next video.